Good day, my name is Imelda Williams. With this presentation, I'm going to give you feedback on the practice bank of the humerus and elbow. I trust that you've worked through the practice bank and that you have your form ready so that you can self-mark your responses. Okay, for case 1, we have a patient who fell onto the shoulder with limited range of movement. I only have the AP view of the humerus. So if we look at the humerus, we can see that at the proximal humerus there is a little bubble. So there is a torus fracture which is inferior to the surgical neck. It is not a green stick fracture, and there's nothing else that is available here. So when we go to our opinion form, the preliminary image evaluation form, it's abnormal, and the only other abnormality would be the bone. And the comment that you can provide is a torus fracture of the proximal humerus inferior to the surgical neck. For case 2, we have a patient who fell off a scooter and is unable to extend the right arm, and an elbow was requested. So if we review the images that we have of the shoulder, and there's 3 of those, so here we can't see any bony fractures. Again, no bony fractures. However, there's elevated fat pads, and it's both anterior and posterior, which indicates that there is an occult fracture. Important when you review any images of the elbow is to see whether there's any dislocation. That seems quite normal. The radiocapitellar line is also normal. And then on the other view, no apparent bony fractures. So for case 2, so it's abnormal because the soft tissue is abnormal. So your overall comment is there's a right elbow elevated fat pad and an occult fracture is highly suspicious. For case 3, we have another elbow view, and this indications is a patient who fell onto the left elbow. So we start off with the lateral view because that tells us the most. So if we look at the lateral view, we can see there's a comminuted fracture of the olecranon, and there is displacement as well. There's also a large elevated fat pad, so there's joint effusion. However, if we again draw our lines, we can see that the radiocapitellar line and the anterior humeral lines are normal. What we do note, though, is there is some gas in the soft tissue, which is probably due to a skin laceration. And here we have our AP view as well, and we can see from the olecranon there is a fracture and that it is displaced. So for case 3 then, it's abnormal and everything else is abnormal. Your overall comment is that there is a comminuted fracture of the olecranon with displacement. There's large joint effusions. There's no dislocations in these gas locules that may present subcutaneous gas related to a skin laceration. For case 4, this is a patient with a previous injury to the elbow and has now re-injured, and the request is to exclude if there's an acute fracture. So if we look at the radial neck of the radius, we can see that there is some soft callus formation on the lateral cortex. And on the lateral view, we can see the same thing. And this indicates that this is a healing fracture and that is not acute. So then for our form, it's abnormal. The bone is abnormal. and then the comment is that there's a comminuted fracture of the radial neck with signs of early callus formation on the lateral cortex, suggesting that this is not an acute injury. Case 5 is a patient who fell and now has a painful right elbow. So when we review the case, it doesn't appear that there's any fractures on the AP view. And similar, if you look at the lateral view as well, there's no fractures, there's no elevated fat pads, and then if we check if there's any dislocations or subluxations, this is all normal. So this is a normal case. So for the normal case, you only need to tick the general opinion normal box and then write a comment similar to saying that it's normal. Case 6 is a patient who had a roller skate injury to the right elbow. So here we can see again there's a fracture of the olecranon. There's multiple lucencies, which indicates that it's a comminuted fracture and it's also intra-articular. Interesting enough, there is a humeral spur. This is a normal variant. If we again check to see if there's any dislocations or subluxations, this is all normal. And there is some soft tissue, elevated fat pads as well. So your overall comment is, so it's abnormal and tick all the boxes. There's an intra-articular comminuted olecranon fracture with minimal displacement. There's no dislocations, and then there's an incidental finding of a humeral spur. Our final case then, again an elbow injury with limited range of movement. So if we look carefully at this case on the lateral view, you can see there's a lucent line going across the radial neck. We can see that there's elevated anterior and posterior fat pads. If we check to see if there's any dislocations, this is all normal. And on our AP view, we can also see the fracture of the radial neck. So for the final case then, it's abnormal. The bone and the soft tissue is abnormal, and your overall comment is there's an undisplaced fracture of the neck of radius. There's no dislocations and elevated fat pads are visible. Thank you.